of things which come from animals. And bioprostheses can actually come from humans in certain cases, the switch aortas, or it can be valves which come out of pigs, which we call porcine valves, or it can be valves which have been fashioned from the pericardium, from the sac that surrounds the heart in a cow. We call these bovine pericardial valves. All of these have different life expectancies. How long the valve lasts depends upon the age at which the valve was transplanted. Younger patients tend to have problems a little bit earlier with bioprostheses, not with mechanical prostheses, but valves can last a long time. In today's world, with some of the, in particular, some of the new bioprostheses, the average life expectancy of those bioprostheses before they need to be changed is 20 years. So they can actually be very, very good and can last quite some time. And I suspect this caller will do very well.
Yes, and indeed, I'm sure she has a cardiologist and internist addressing it, the Coumadin level and so on, all the basic maintenance issues. So, but these two, as he stated, 6 years, and she still has a good 15, 20 years left of life left in her, and certainly life left in the patient also.
You know, Dr. Verena, I had a patient 20 years ago that I did an intervention on in Homa, and there was really a lot of doubt as to whether I should do it because she was 80 years old, and there was a lot of thought, is she too old to do this intervention? But she was very vibrant and very with it. This summer I danced with her at her 100th birthday. So it's very interesting. People can now live to be quite old.
I guess that's a testimony of furthering this kind of care, irrespective of the age of the patients. It looks like we have another caller on line 2, Steve from Jennings. Steve, are you still there? Please go ahead and ask your question. You're live.
Yes, I have a question. I have a lot of sebaceous cysts or lipoma on my chest area, like on my stomach and stuff. And I was wondering if that's something to be concerned about, maybe getting checked out.
Well, it looks more in the line of dermatology, but we can just probably refer you to an internist. Let us just hang up and probably address it in a more broad fashion. We'll address your question too.
Yes.
Well, he has asked a question about sebaceous lipoma. It looks like two of them. One is he's talking about sebaceous cysts, which can happen with all the follicles getting infected and having those, and depending on how hairy he is and what kind of hygiene and other types of issues, sebaceous cysts can happen. Lipomas in general on the surface of the body are smooth, kind of well circumscribed, soft bumps which can get quite big, and depending on the area that they are in or what kind of nerves or other things they can impinge on, in general they're very benign and probably more of a headache with respect to cosmetic purposes rather than, but the other thing, the atheromas that we are more concerned about in this cardiovascular business are depositions of fat right around the tendons, which are the tendon xanthomas, and the other ones are surrounding the eyelids, which are warning signs to certain kinds of hereditary hyperlipidemias or increased fat states, which can in turn also cause damage to the lining of the arteries. So those are different. I assume that Steve is talking about the more benign variety, yes. And those can be treated in some instances with antibiotics by internists should be able to take care of.
Yeah, the two things we worry about are what we call xanthomas, or white dots right on the inner surface of the eyes, because that's often a clue of high cholesterol, and neurofibromatoses, which are actually fibrous tumors about the body, because sometimes that's a clue that a person may have adrenal tumors or other things such as that. Those would be the two clues of cardiovascular disease, but typically sebaceous cysts are not a clue of heart disease at all.
Well, here we have one more call from Betty from Eunice. Betty, go ahead. Please, you're live. Go ahead, ask your question, dear.
Oh, yes. I would like to know that the heart, there's 4 stents put into heart. And how many years can this last in the heart, the stents?
Do you know that they are the medicated stents or non-medicated stents?
They well, the patient has medications.
But did they tell you that when were the stents done? Are they in the recent past?
About 4 years ago, 4 to 5 years ago.
4 to 5. We will address this question here in a second. Here, I'll hang up on you here.
Beg pardon?
Sure.
I will hang up and we'll discuss about your question.
All right.
Okay. Betty, the most common stents that are used in the heart are balloon expandable stents made of surgical stainless steel. And surgical stainless steel lasts forever. So to start with, the stent stays there forever. And actually, some of the very first stents ever implanted are still widely patent. I was one of the original stent investigators in the United States when there were only 10 stent centers, and we were the only center in the state of Louisiana that was one of the original stent investigator centers with the original J&J stent. It was the very first stent trial performed in the United States. These stents typically last forever. Now the problem isn't that the stent won't last, it's that sometimes tissue grows within the stent. And this tissue that grows within the stent may choke off blood supply, or clot may actually form within the stent, which can be a problem. And sometimes if the clot forms, it may be because the stent is not fully expanded, may not be big enough, and simply expanding the stent further may help. There have been recently several reports in the literature in which we're starting to see that occasionally small fractures may occur in some of the stents. And this is a little bit alarming. There is a lot of research going on right now looking at different alloys, in other words, different composition materials that will be yet stronger and thinner, that may allow us to put yet thinner strut stents that will be stronger and be less likely to have any fractures or other problems. But some of the stents that we placed in the very early trials in 1988 are still wide open. And so that is, now more than 20 years. So stents can last a long time.
The ones that also, that to further that question, since she had said that now it seems like upwards of 70-75% of the stents that we are implanting these days are the medicated variety of stents, which there are a few varieties of those, and probably 2 main varieties in the market, which seem to have a very good track record, but they come with a little bit of warning sign. These medicated stents certainly have revolutionized the whole stent industry, where it used to be placing multiple stents in each patient was a bit of a, we did it with some amount of hesitancy, because the more amount of metal, more amount of artery that you treat with stents, with non-medicated stents, the greater the degree of problems. While they were not damaged, they would have this kind of a scar tissue form in them. We ended up coming every 6 months or so in a good 25% of the people and retreat them. But with the medicated stents, it seems like the advent of re-intervention has gotten longer, but the downside, of course, is that the patients have to be far more consistent in taking their blood thinners, the Plavix and the clopidogrel and the aspirin that we talk about. And there are a lot, and premature cessation of taking these medicines could lead to harmful effects to the patient in terms of stents clotting off and causing potential heart attacks, which could be life-threatening. So while there is definite advancement with the medicated stents, while they are the main variety of stents we are using these days, they still have to be used with proper judgment, and patients would have to be guided and steered very, very carefully. And once the patients and the practitioners observe those precautions, they do seem to really last for indefinite periods of time. And we have had stents placed for the past 5 years, and patients have done remarkably well. So to her question, I think these stents do very well as long as you take care of them very well and follow up with the medical advice given to you. So, and we'll continue our original discussion at this juncture. We were talking about how we have enabled development of comprehensive diagnostic as well as initial consultative services for a variety of problems, including vascular problems like angina, high blood pressure, high cholesterol, heart attacks, strokes, and then it expanded on to all the comprehensive vascular services, diagnosing blockages essentially practically from the neck or head to literally to the toe, and everything in the middle, including the aneurysms, including and the whole other line of pacemakers and defibrillator services. And how, typically if you look across the models in the country, in general, small or large groups, they tend to specialize in one or two things, and rare is it to find a model where everything is done to perfection. There are interventional cardiologists in our group who are really dedicated and very advanced. Endovascularly, of course, we can unabashedly claim that we are on the forefront of this whole endovascular fight. We are leading against this whole vascular disease. And so is the case with pacemakers and AICDs. We've invested enormous amount of time. In terms of the vision, what has led to that, and how did we end up staying cohesive in providing all these services?
Well, I think some of this was by design, of course, and we looked at this field and said, you know, what are the problems? We first had to assess what were the problems facing patients in our areas. What was killing patients, what was maiming patients, what was hurting them, and then say, how do we address these problems? How do we help people with these problems? And what sort of training do we have to go through to address these problems? How can we treat these people better than they've been treated before with this? And so we really addressed this with a lot of work and a lot of effort, and many of us have subspecialized in particular areas. One of my areas of great interest, of course, is limb salvage, as is yours, when you came down and actually worked with me in the past and really became one of the world's experts in limb salvage. We have people who are, addressing arrhythmias. We have aneurysm experts. And so I think it's because we as a group looked at these problems and tried to make sure that we had people that could address each of these problems. But the first thing was to try to identify what were these problems first and foremost. Once we knew what they were, then we could seize upon what to do with them and address them. There's still other areas in the future. I think that we're going to see continued growth in structural heart disease. We certainly do a lot of work with mitral insufficiency now. I suspect, again, with aortic stenosis in the future, there's a whole lot of work going on with non-surgical repair of aortic valve disease worldwide. And there's also work going on for even heart failure with structural non-surgical repair. So I think we'll see, continued growth throughout this entire field of cardiovascular medicine.
Yeah, that's really a refreshing thing to be able to bring such comprehensive services, and that also keeps us as practitioners on the cutting edge and makes our day go by a lot easily. As tiring as they are, they're a lot more rewarding when you're able to provide state-of-the-art services to patients. Pause for a second and take a call from Dave from Wilplatte on line 1. Dave, go ahead, you're live.
Yes, I have a question. My wife has been having what we think is maybe heart palpitations at night when she lays down to go to bed, and it's been affecting her sleep. She did see her regular doctor, and he had prescribed her some mild medicine for high blood pressure and also some medicine for like nerve pills. And my question is, can heart palpitations, if they last, for more than weeks or months or years, can that lead to cardiovascular disease?
Just briefly, how old is your wife, Dave? I'm just...
in her late 40s.
Late 40s. Well, we'll address it in a broad fashion here in a moment. I'll hang up here and we'll talk about palpitations, especially nocturnal palpitations, and what are the implications.
Thank you.
Well, so the question from Dave is regarding his wife. She's in her 40s and has experienced palpitations. Seems like especially at night times, and his concern is what are the causes? Is that a warning of cardiovascular disease, and how should she go about?
Well, palpitations are when you feel your heart beat. And that's all really a palpitation is. Now, a palpitation can be